Good morning. My name is Vishad Nabili. I'm an associate professor and residency program director with the Division of Facial Plastic and Reconstructive Surgery at the Department of Head and Neck Surgery at UCLA. It is really a privilege and honor to be here today to discuss a topic called platelet-rich plasma for facial rejuvenation and hair growth, an evidence-based approach. Why evidence-based approach? Oftentimes, many patients have asked me, as well as even my staff, as to why do patients want to come to a university setting such as UCLA for aesthetic, cosmetic, surgery, procedures? Well, why? And truth be told, I think many people think that the university may not offer these, and we do. We have experts. So the first reason people come to the university is experts in that area. And we have experts not only in the Division of Facial Plastic and Reconstructive Surgery, but also in the Division of Plastic Surgery and dermatologic surgery, as well as oculoplastic surgery. So I urge the audience to look up all of the experts in those divisions who really offer state-of-the-art treatments. That's one reason. Second reason, we don't necessarily need to do the latest and greatest at UCLA if it has not been studied, proven to be safe, and the evidence is out there. Platelet-rich plasma, especially in facial rejuvenation and hair restoration, is quite popular. It's hot, as the term goes, but we have to make sure the evidence is there. And the goal today is to not only introduce the concepts, talk about the evidence, demonstrate some of the studies out there, and tell you how I, as one of the experts at UCLA, came to the conclusion to offer this to patients based on the evidence. And so that's the goal today, and we'll go through each of those areas, and I look forward to doing this. So the three areas. We're going to talk about PRP. You'll type this up on Google and you'll see many things and many avenues for where it works. But really today, in terms of facial rejuvenation and hair regrowth, the goal is what works, what might work, and what really does not work based on the evidence. That's the theme today. So it's been used actually in aesthetics for a long time, whether it's to fill in face, breast, gynecologic, urologic, skin rejuvenation, which we'll talk about today, hair restoration, wound healing, skin graft healing, and combined with fat transfer. So why platelet-rich plasma? It really started years ago, almost probably maybe even over a decade, in orthopedics, stem cells, joint regeneration, and now it's gaining a lot more popularity and also scientific backing in the area of aesthetics. So why? This slide really demonstrates all the different areas that we have studied platelet-rich plasma, but in essence the conclusion is there's a variety of growth factors that are released from our own platelets. So if we can concentrate those platelets and put it in an area that needs regeneration, rejuvenation, it makes sense, and I'll demonstrate that today. I'll try to be brief on the scientific side, but it's good to at least think about where it is and why the evidence is there. So platelets actually form a mesh, and they actually eventually stimulate stem cells, leading to regeneration. So in this little mesh, we have growth factors. They're released by the platelets and leukocytes, and this mesh happens when we have an injury. We cut ourselves, there's injury anywhere else. The platelets are the first things that go there, stop the bleeding, but we don't really think about what else is happening. And so it really attracts other cells to come by, and the long term is the stem cells go there, cause our wounds to start to heal and our scars to form and regenerate. Why the benefits of using platelet-rich plasma? I think the most important and obvious one, it's from you. It's your own blood. So it's free of disease transmission. There's no hypersensitivity or allergic reaction to it. We are going to demonstrate that it enhances wound healing, augments tissue angiogenesis, means building blood vessels to improve healing, and adipocyte and keratinocyte generation. Those are the terms used for fat cells that can regenerate, as well as skin cells in healing. So here's a caricature version of the process of how we use PRP. The platelets are drawn from your blood. We separate it by using a centrifuge. It's taken and processed through a little machine that actually spins down and separates the contents of our blood. And the tubes that are in, they're not just any tube. Many companies out there now are very good at producing the tubes that are needed for PRP, but it has proprietary contents that separate the blood from the plasma and the platelets. And among the platelets, what areas are higher concentration and lower concentration. I'll touch upon that shortly, why that's important. How do we get the PRP? Well, we draw the blood, but then you'll maybe see in Google or visit doctors, and there's different techniques, and well, why one better than the other? I'm going to demonstrate what we know and why we at UCLA Facial Plastic Surgery focus on our methods. It's based on the evidence. So one spin technique, two spin technique, adding things to the platelets, does that really help? Does it not? We'll talk about that. So the one spin technique, meaning you take the blood from an individual, you put it into the machine, it spins it once, and essentially you're using the contents from that. The goal is to separate the platelets, but not just separate them. You need them to be rich of platelets, hence the term platelet-rich plasma. Not low concentration, but the higher the concentration, the better, the more growth factors, the more healing as the goal. So when we separate it, you can see here, our goal is to get anywhere between 2 to 8 times the whole blood amount of platelets. So however number of platelets we do have, if we can concentrate it and then deliver it to the area that needs healing, that's the goal. So this really, the one spin technique, it works for using it to fill the face, to regenerate, whether you add it with or filler or not. It can last for anywhere from a year to year and a half or even longer. It's useful for certain areas of the face that we'll demonstrate under the eyelids. It's effective for hair growth that we'll go into, and also for resurfacing and minimizing some of the inflammation. Something that PRP has been helpful for is we know it heals. So if we cut ourselves, we have scars. If people undergo lasers, which a lot of people do for aesthetic reasons, or they undergo some type of facial treatment that causes injury, well, maybe the PRP can actually help heal, and it does. The two-spin technique requires more blood. The goal of the two-spin technique is you first separate the platelets from the initial blood. You spin that down again, get more concentrated, takes more time, more blood needed, more steps involved. And in orthopedic literature, it's really helped a lot using this technique to really get the highest amount. And we'll talk about what we use and why. And you may look at, well, are we just using PRP? It gets confusing. So the goals of today's webinar is to hopefully clarify some of that. And the ultimate goal is to educate our patients. What I really want is for patients to come in educated, they've done their reading, they come in and they understand why we're doing something a certain way. And if they don't understand, to ask about it. As opposed to they just come in, we do PRP, and they're going to get it done. But they really don't know, why did I get it at UCLA? Why was it different? Why does it work? It's so much better empowering our patients to understand what's going on before they sign on for any elective procedure to help enhance their skin, or their hair for that matter, as we'll get into. So sometimes you'll realize the platelets, they're activated. The term activated is used, or they add something to it. For example, a fibrin matrix. The thought behind this, simply put, when we cut our hand, for example, we bleed. And then a few seconds later, a minute later, a clot forms. If we go in with a microscope and look at that area, the platelets are there, but they got activated by the injury. So that in and of itself will activate those platelets to release the growth factors. The thought came in, why don't we add something to our platelets while it's in that tube, ready to be injected, that already activates them? And that's what this matrix is. And we'll talk about why I personally don't use this, and many of my colleagues do, and there's nothing wrong or right about it. It's just technique, the evidence behind it, and for me, less is more, and we'll talk about that. So what we use at UCLA Facial Plastic Surgery, people ask, well, what is your device, what company? I have no relation specifically to this company per se, but this is based on the evidence. We want something that's simple, safe, the evidence is behind it, and so we use Eclipse. It's been around quite a while. This got a lot of popularity. This was the company that was involved with one of the creators of what was told as the vampire lift. And a lot of people ask about the vampire lift. It's trademarked. The physician behind it was a brilliant person who came up with the concept of including your own blood, adding some things to it, whether they're fillers, and to create these types of lifts. And I urge you, if you're interested in that, to look up on the vampire lift for the original creators of it. But this company and what they use, they have a version that's now a highly concentrated tube, and I'll talk about that. So why use the Eclipse system that I use? Well, simply put, in the old system, initially we had these regular tubes, And we described here that it separates the blood from the platelets. But if you look at this picture, there's a platelet-rich area of plasma and a platelet-poor. So if we use a higher concentration tube, that still involves only poking you once, drawing only one tube, but we get a larger amount of platelets and a larger amount of the platelet-rich, it's far better for the patients. We do one spin, one blood draw, one tube. Older systems, if you need that higher concentration, maybe more blood draws if you can't get enough from one tube, maybe another needle stick, and you need several tubes, and it gets costly because the costs are per tube. So I think this is really a big game changer for us, and Eclipse is one of the companies that provides it. So let's get into what works. Kind of introduce the idea of platelet-rich plasma, how we remove the platelets, and how we prepare it. But let's talk about what works. So the three areas that work, and we know that from the literature. And let me just digress for a second. You know, platelet-rich plasma in aesthetic surgery has been around for a while. I would say at least 5 to 7 years in aesthetic facial plastic surgery. And people ask, Dr. Nabili, how come you're now just starting to use it? I was a little bit skeptical, and I wanted to wait and see the data. And lo and behold, the data is coming in. And so this is the areas that I will demonstrate for you from the literature that it works. Facial resurfacing, skin rejuvenation, either PRP alone, PRP with microneedling, PRP with Fraxel or CO2 laser. Hair restoration. Multiple protocols now show positive results. Evidence for improvement in pattern hair loss for both men and women. Evidence for improvement in spot hair loss. And there are some conflicting studies, and we'll talk about that as to what our protocol is now at UCLA. And then injection of PRP with or without HA filler. You may notice the term, what's HA? It's hyaluronic acid. Many people don't even know what hyaluronic acid is, but it's simply put the fillers that are used today, that's the most popular type. Whether it's Juvederm, Restylane, they use a hyaluronic acid. And so the concept of adding it with your PRP, we'll talk about that. And there's some evidence that shows it does work. So let's start with PRP for skin rejuvenation. Let's look at the evidence. Okay, probably a really technical slide, but I wanted you to have to see it. What are some of the mechanisms scientifically for how it works? We think that basically it goes down to the biologic level. And in essence, what it does is it improves the collagen. The main point I want to get across is PRP, based on the literature, doesn't actually act as a long-term filler. So if you get PRP injected and you think, for example, under your eyelids, it's going to last a long time from the moment they put it, it's not true. What it does is, for the short term, probably a few hours to a few days, maybe even a week, it may feel or look more full because the platelets are injected. And then it decompresses. The filler aspect disappears. But yet, over the next several months, the rejuvenation and healing causes the texture, the tone, and the contour to improve. So it's not a filler in the sense of Juvederm, Restylane, the hyaluronic acids, but it actually improves the collagen. So these are just some areas, and you can get PRP to the entire face, scalp for hair, but since we're focusing on facial rejuvenation, you can also get it to the neck area. And basically these are the same, very similar to injections of Botox, small areas that we inject, and different layers. And I'll show photos of where we want to get in the layers of actual PRP to get in. PRP topical. You may look and say, gosh, I've heard that they put PRP, they put your platelets and just literally place it on your face topically. That does work, but it really works if there's actual injury or insult to the tissue so the PRP can get in. Injecting it gets deeper and it causes the collagen to regenerate and heal at the deeper level. I put this slide courtesy of one of my mentors and colleagues, Dr. Gregory Keller, who's been really a pioneer in PRP and lasers for a long time. And this slide is someone who's had PRP to the cheek and eyelid. They look rejuvenated. This is months down the road. So the filler effect is gone, but the long-term changes have improved. You still see the fine lines, so it didn't really give the dramatic filling effect, but the overall complexion, the overall tone, texture has improved. This is a great study because it looked at truly the concept of PRP not as a filler, but really improving the skin texture, improving scars, acne scars, and so forth. So again, they looked at 23 consecutive patients, and what they did was they actually did microscopic photos really close up to look at before and after, 3 months after. Those little fine lines, the texture, the crepey skin with age-related changes improved. It wasn't an instantaneous fix, but it was their own body's product, the platelets, rejuvenating their skin texture. A forehead scar from injury. It's been there for a long time. Treating this with PRP improves the scar. Acne scars. It's really gained a lot of popularity with lasers for acne, microneedling, but then adding the PRP, and we'll talk about that, improving the scars. One thing I will address on this is, and we'll talk about our protocol, the PRP is not a one-time. So the issue is the evidence will show you serial injections or administrations do improve, whether they're 1 month apart, 6 to 12 weeks apart, and then someone asks for how long. In general, for most studies, we'll demonstrate at least 2 sessions, and we'll talk about hair, which has a very specific protocol. Let's go to the concept. So what does this all mean, Dr. Nabili? Okay, so how do we improve the effects of PRP? So here is the layers of our skin in a caricature showing all the different layers. Healthy, youthful, you see a lot of collagen, fibroblasts. These are the things that give us good texture, good tone, lessen the sagging. As we age, we lose a lot of that. Our skin becomes more elastic. Here's the concept. If we damage the surface, that will stimulate healing. We know that when we cut ourselves, we start to heal. But as we damage, if we can inject or administer some growth factors from platelet-rich plasma, either from above or below, that's the concept. How do we do it? So one way to improve the effects of PRP, get at it from both levels. Attack the surface, activate the PRP by the injury, and then inject the PRP to the deep level as well as topically. How do we do that? Well, we already know. Many of us get facials with laser or microneedling. Microneedling, there's 2 different more commonly used devices out there. There's a roller that's quite popular now, and there's a microneedling pen. And what they do is there are these fine needles, and they actually penetrate depths of the skin. I need to bring up one point because I've had patients as well as some of my staff members say, Dr. Nabili, I was at the store and I saw an over-the-counter microneedling device. Yes, there are some out there. Here's the difference. If you go to a board-certified aesthetic surgeon and they're certified to use these, they have a longer depth that is critical for us to get that response. If it's over-the-counter and you see it, chances are it's something that's either off-market and we don't know the usages, but also it does not get the accurate depth that we need. So the injury happens. We go back to our slide. We talked about youthful, age-related, cause the injury with microneedling, and look what happens. Stimulation of new collagen production, get us back to that youthful skin. Let's look at the data. It goes back to evidence-based. So does microneedling with PRP help? Here's a study. So they did combined platelet-rich plasma, 50 patients, acne scarring enrolled, and it was great. These patients went to, they're called split-face studies, and later on for hair we'll talk about split scalp. These are people who volunteered. This is in the early works of looking at the data and comparing the same patient either side, and improvements were seen with the PRP-treated side in reduction of acne scarring. Here are some pictures. Again, pre and post. One side got, the upper side got the PRP, the lower side with microneedling, and the lower side got the microneedling with saline. Same thing here and here. Improvements. So we do know that if you can combine the effects, far better. This is another slide, and it's a little bit small, but again, looking at lasers. I talked to you about that as well. Can we improve healing, the downtime, with the PRP? And lo and behold, you can. These are people's forearms that were treated with laser. Redness improved, and the discomfort improved with the sides that had the PRP. Biopsies. Some patients volunteered in these studies. This was by Drs. Na and Cho et al. And essentially looking at that caricature slide that I showed earlier. Is that true? Is the evidence there? And lo and behold, when we looked at the slides of the biopsies, the collagen was thicker. In that picture that I showed earlier, as we age, it becomes less and less apparent, less tone, and more elastic. This improves with the PRP. Combining, and I don't want to focus too much on this part of it, but this is going back to the idea of lifting the face and filling the face with fillers and PRP. This series looked at 94 patients, and lo and behold, there are improvements in their lower eyelids, the nasolabial folds, around the mouth, firmness, texture. Not only the filler helped, but with the PRP it helped as well. Okay, and now we're going to go into PRP for hair restoration. Let's look at the evidence. Okay, first slide again. It's the more scientific slide. What are some of the thoughts from the actual science of it and what's going on? And this explains a lot of it, and you can read it. But really, I want to just tell you, how does it work, really? There are, in certain patients who have male pattern or female pattern hair loss, there's some dormant hair follicles that are remaining. These are hair follicles. Hair has a cycle of growth, and they're termed anagen, catagen, telophase. You may look these up and understand what's going on. But at one point in this growth phase, some of the hair follicles or hair cells that we haven't entered the actual growing phase, and they're dormant. And they may need a kickstart. Simply put, adding those growth factors with PRP, will it work? Let's look at the evidence. So, how does this really work? Let's go through the steps before we look at all the studies out there. We draw the blood again like we talked about. We spin it. Some areas in some studies and some of my colleagues will activate it. I'll tell you why I particularly don't add something to the PRP, but you can. And one of the options was the fibrin we talked about. Some other options you'll think about is calcium gluconate, other scenarios. And then it's injected. Once it's injected, we get hair growth, increase in hair density and thickness. So before we look at everything, why would you want to consider PRP for hair loss? I respond quickly by saying, why not? Many people are on oral medications that affect our hormones. They work. But if you look at the data, and more recently, there is some controversy as to the risks of being on these long-term oral medications that affect our system with potential serious side effects that we don't know. It's inconclusive. And it's usually in the urologic literature that you'll read about it and find out. But the real question is you have to take that pill, whether it's Propecia or others, every day, forever. The moment you stop, the hair loss happens rapidly and comes back. Some people talk about taking herbals and biotin. These are all oral medications with really, again, we don't know what the side effects may be, although it's been quite safe in thousands and hundreds of thousands of people throughout the world. You don't need a topical medication. Rogaine, for example, minoxidil, it causes hair growth. You got to put it on topically. It may be greasy, it may be bothersome to many, and again, lifelong. Every day, sometimes twice a day. Hair transplant, amazing. I think, and this is in no way trying to say we shouldn't do hair transplant. In fact, our hair transplant experts, and some of them at UCLA as well, and out in the world now internationally, have now known that when we do hair transplants, if we add the PRP, it may last longer or improve that. So we're learning from both sides. But why hair transplant may be an option not for everyone? Here's why. There's two major techniques. One is to cause a scar in the back of someone's scalp. And if you're going to lose hair, it's an evolving process. 20 years from now, after your hair transplant surgery, you will lose the natural hair that you're going to be continually losing, and maybe the scar will show. The other topic, or really popular method now that's really changed things for hair transplant surgery, is when they just take these follicles. It's called follicular unit transplantation. Tiny holes, essentially scarless. However, I argue that if the hair is lost over the next 20 years and you get thinning even in the back of the hair or less hair, those punctate small areas may show themselves. So PRP, no long-term medication. It's from you, and if it helps, great. How long will it last? We'll get into that. Indications. So as of now, the two most common ones, and I put this differentiation because it's really used loosely. People think, first of all, there's only male pattern baldness. That's incorrect. It happens in females as well. The difference is in males, it's been really studied to details as to how it happens, where it happens. The back is not affected. Women, for pattern hair loss, same concept, androgenetic alopecia. Can occur in women and does occur. It just hasn't been studied to the same level, and the way it has hair loss may be different. It may be just global thinning of the hair. And then spot hair loss. What is that? The term alopecia areata. Most of the studies have now demonstrated maybe an autoimmune phenomenon where you suddenly have patches of bald spots. PRP has been shown, and we'll demonstrate that. Okay, let's look at the data, and I've highlighted the most important parts of these studies, and I'll tell you why. So, androgenetic alopecia, the male pattern, female pattern hair loss, 23 patients enrolled. Here's the key points. 3 treatments, each 1 month apart. Patients followed for 2 years. No relapse until 1 year, and we'll talk about that. And increased hair density at 3 months, no side effects. Here's the data. Pre-post PRP. Definitely more than 1 session will get you here. That's the key, and we'll talk about that. Another study. 1/2 of the head was given PRP, 1/2 was not. The goal, again, is the recurring theme that I want to get across to you. 3 treatments, 1 month apart. Remember those phases I talked about, anagen, telogen, the different phases of hair? This all increased, and there was an increase in density of the hair. Evidence is out there, multiple different studies. Why we look at this slide is because we see the different changes that happen, 3 months, 6 months, but also at the more higher magnification, we see increased thickness and density. 2 injections, 3 months apart. Well, the other 2 studies did 3 injections a month apart. Bigger picture, more than 1. Female, male patients, different scenarios. For the female patients that have come to me, oftentimes, and this may be relevant, it's usually not an area that's bald. It's not an area like men where myself actually am getting some hair loss in this vertex area we talk about. For females, the general scenario is they'll start to realize, and you may appreciate this, the light situation, and when you interact with someone, that's when you notice it. Sometimes the frontal area or the part line, you're conscious of it because it looks thin. If you're not in direct light, you're fine. And those are the areas that PRP has actually helped my patients. I put this slide not to inundate you with a lot of data, but really a meta-analysis is really good. You look at many studies and you look at all of their patient populations and do statistical analysis, because the more numbers you get, and if you notice trends, that's very helpful. And the goal of this was looking at 4 studies, increasing the patient population to 60. Then basically the hair density had increased, so the data is there. A specific paper looking at female, and I'm going to demonstrate in both the hair restoration as well as the skin, publications that may say, well, Dr. Nabili, this study shows no improvement. Here's the problem. They did this in 26 women, and there was no change. I argue with this paper because they only got 1 treatment, and they didn't show any change. That doesn't mean the study is not working, but most of the literature now shows you need to have repetitive to activate those dormant hair follicles and amp them up and continue with it. So what we do at UCLA with PRP for hair restoration is the following. And if you come and visit with us in consultation, having this background, I urge you to see this video, then come visit with us. We have a detailed protocol. It's not just we do the PRP. We actually have a protocol that says, based on the evidence and what we want to offer you, is we want you to have a success. In order for you to have a successful result, we need to take all the evidence that's out there and try to combine it to make it simple, safe, and worth your while to give you the best results. So we have a protocol for males and females that are different. We use the evidence-based approach. I use the high concentration PRP only. For hair, only high concentration. It makes total sense. The data out there shows the higher the concentration, especially for hair, is needed. Serial applications. If a patient comes to me and says, Dr. Nabili, I want to do the hair, but I'm just going to do it once, I actually won't recommend it. And I will recommend others who may, or just have them go somewhere else. Why? Because evidence-based approach, one may not make them happy. And it can't be one, then come back in a few months. So the protocol is a monthly protocol. For women, we do 3 months, 1 month apart. For men, 4. And like the data shows, after the second session, and usually by the third, is when we start seeing the changes. And the changes continue for beyond 1 year. We do a long-term follow-up, minimum 2 years. Here are some patients after 3. First session, maybe we got some hair. This is now growing. Pre, post, male. These are my patients along with Dr. Keller's. Pre, post, female. And, you know, I want to really educate the audience. So what I also think you should also look up is on Google, and if you look up on, I believe it was on ABC News, but an actual physician underwent PRP, and if you Google it for hair, and you'll see, and it really was dramatic, and that really helps people to see, yeah, it's being done, it's been popularized, and even physicians have undergone it. And some of my physician colleagues have had successful hair growth. That's pretty remarkable. So other indications, so we talked about this spot hair loss. And so spot hair loss, they think it's autoimmune, you give steroids, and so that's normally what we do. But when we added PRP, it was improved. Less hair dystrophy, less burning, less itching, and increased hair. This is people who have this spotty baldness. It's not based on anything except that it's random and areas have loss of hair. If we didn't treat the top part, same patient, the back had this alopecia areata, spot areas of baldness. Same patient, the back was given the PRP, the top of the scalp was not. And even in this population, it works. So now we know what works based on the evidence, and now what might work. This means not necessarily proceed with caution, but maybe we need to be optimistic, but still guarded as to the results. So injection of PRP without HA, that means taking the PRP and using it like a filler. I already gave the preface ahead of time. If you think it's a filler, you may not be happy, because when someone gets a filler, and it's usually associated with HA or hyaluronic acid, we want immediate results. I get that. You want to have your lips more full. Get rid of those tear trough areas or nasal jugal folds right under our eyelids and have it last, not just go away, and maybe you don't want to wait months at a time or have the PRP repeated. So injecting it without HA as purely a filler, it may work. We don't necessarily know 100%. If someone's getting fat augmentation where we get fat and we use fat as a filler, can the PRP help with that? Let's look at the data. And then if any one of you out there has ever had a skin graft for any reason for reconstruction, you'll realize that donor site, or where we take the skin graft from, is exquisitely painful. And it's a very brief, simple procedure with a lot of morbidity for patients. And can we help with that? Maybe. So, filling the face with PRP. Here's some data, and you would argue that there is some improvement. The argument is filling the nasolabial folds and the acne scars in the combination, do we actually improve the lines? Do we improve the lines around the mouth, the wrinkles? It's hard to say whether the PRP is actually doing the filler job as a normal run-of-the-mill HA filler is doing, or is it really improving the tone, maybe lessening this line and fine lines here, and overall improving the collagen that makes our skin less lax, less sagging, hence less folds. And if you remember my last webinar where we talked about mid-face lifting, I really tried to focus on these lines. They can be treated, but the source is not to necessarily fill them in everyone. It's really moving the skin back up or toning our face, cause and effect. And if you're interested, please look at that webinar as well. Again, a more focused look, looking at the actual slides. I don't want to get too much into this, but really showing that when we added the platelets with some fibrin matrix, it induced all the things that were good for platelets and acted in terms of improving fat, blood vessel, rejuvenating, and acting as a filler as well. So facial wrinkles are nasolabial folds using the PRP with the matrix. So why the PRP with the fibrin matrix? I actually think if you're going to use PRP as a filler and you want that effect to last longer, it's better to not only activate it with the fibrin, you have to add it, but it also makes it more gelatinous or gel-like. The consistency is better, more like a filler. And the results have shown that it does help. And a really prominent person who's really done great work in facial plastic surgery is Dr. Anthony Sclafani, and his name is written here, and he's based in the East Coast, and you can look up his data as well. I personally don't believe in my practice of adding anything to the PRP. I want to keep it simple. I want to make it easy on patients and just use their own blood and not add anything else to it. Another study really just looking at pretty dramatic results in the folds under the eyes and seeing the results improve with the PRP. And one more for facial wrinkles. Again, more and more data out there. Again, this might work. I think it's very promising. We just need more data to show long term, is this the end all compared to our fillers out there? And then fat grafts. I mentioned that if you are getting any kind of fat injected, one of the problems with taking fat from somewhere and putting it in our face for rejuvenation, it works great. It's a part of you. Does it last? Because it may atrophy or dissolve. And so does the survival of our fat grafts improve? And it might. So I think the data is promising. I also want to show the slides that it doesn't work. So these are patients who have what's called lipodystrophy. It's HIV related. And the study looked at people who have a lot of wasting. And if we add the PRP to fill and improve with fat, does it help? And really, if you gave the fat with or without the PRP, there was really not much change. So again, might work, more promising data, less not promising data, but still we need to be guarded. This, from my practice, actually is very helpful because I have a combined practice. I focus on facial aesthetic surgery, but also facial reconstructive surgery, and skin grafts are used often. And if we can do anything to improve it, I think that would be beneficial to minimize the pain and the donor morbidity from it. What doesn't work? Simply put, if you look at the literature right now, what really has been studied that doesn't work, and I think you have to also be skeptical because when there's something great and we get a lot of positive results, we try not to, I think human nature is to keep looking for ways it's not going to work. But really what we're doing is in facial plastic surgery, we're testing in different areas to see can it improve. Facelifts, most common complication, international, worldwide, the highest risk, even though it's small, is a blood formation after. It's called a hematoma. It has to be evacuated. It may affect wound healing. Aside from having very good surgical skills to minimize that risk, studies looked at, well, can we add this to minimize that risk of the bleeding, the bruising afterwards, the swelling? Can we keep making it more improved and less downtime for patients after a facelift? And really, there was no difference. Again, the studies were small, but this is good. We tried it and it doesn't work. And so the literature shows that it may not be. I think good surgical skills, good technique, good postoperative care is the best result for facelifts. And again, this is just the data scientifically showing no significant difference in risk for hematoma using the PRP. Okay, so let's summarize what works. So what I've demonstrated today from an evidence-based standpoint is in facial rejuvenation, specifically of the skin, if we combine it with microneedling and we combine it with fractional CO2 laser, I think it'll give you the best result. By itself, it's good, but I think combining it, and we offer microneedling in my practice, will help. And I work closely with our dermatologists, and I think that's really important too, with CO2 laser. My colleague, Dr. Keller in Santa Barbara, has the laser components, and that works really well with the PRP. And now let's go to hair restoration. So the good news is we want to offer patients all avenues. Another one of our colleagues and member of the Division of Facial Plastic Surgery is Dr. Jeffrey Ronsley. He is an expert in hair transplantation. Phenomenal results. And I think he's looking at PRP to actually amplify that and improve it. But we want to offer both. Someone who does not want a hair transplant, they can get PRP for it, and we offer both services. Again, we do multiple protocols, positive results. We know that works. It works in pattern hair loss, spot hair loss, and there were some conflicting data, but the data is conflicting if you don't follow a protocol. You can't just say, well, for you, we'll do it today, and then maybe come back and we'll see. And then for the next patient, one time we'll try. So if you're going to come to UCLA, we want to give you the best result, evidence-based, a protocol. So we get you to get the best result. And then injection of PRP with the filler, I think it works, and the data shows that. What might work, just a brief summary, if you inject PRP alone in your wrinkles, it may work, it may not last, it needs to build on itself, and you need to look at it long term. Augmentation improves survival with fat, we talked about that as well, and it improves that, and then hopefully the donor sites from the skin grafts. And then what doesn't work, if you're getting a facelift and we're thinking about adding PRP, chances are it may not work. So we're still skeptical, although the data is not out yet, we can't say fully no to this yet. I'd like to thank both UCLA marketing, the university, the health system for really giving me this opportunity. It's a privilege and honor to be here and to share with you some of the things that we're doing and some of the exciting times in facial plastic surgery. I urge you to email me, contact our office, and really look at our websites to see we have many experts, again, at UCLA that focus on facial plastic surgery. Thank you again. I'd like to open it up to any questions in the audience. Great. So, good. So the first question, and we kind of went into it, but I want to talk about it again. What are the risks with PRP? There really has not been much risk. I think one of the risks is really the actual procedure, and I think I want to talk about that. What I mean by that is when you come in, you have to have your blood drawn. So there's some things that we talk about, and it's part of our protocol. Stay hydrated. If you go and get a blood test anywhere, and if you know, for example, that it's hard for the nurses or the doctors to draw the blood, then we recommend really staying hydrated the day before and coming in and staying hydrated. That's mainly the main risk, that you may need more than one needle poke. If you're hydrated, I do my own needle draws. I will draw your blood. I feel very comfortable with that area, and I think that's important too, to make sure that the experience is good. Get some bruising there. When we put it in the scalp, I have not had any side effects, nor has it been demonstrated, but anecdotally, patients tell me, and some of the protocol things we talk about is to wash the scalp with warm to even hot water afterwards. It's a soothing feeling. It lessens the bruising. It dilates the scalp. It improves the hair. The downtime with PRP was another question that came up. What is the downtime? Good question. So I think it's technique. I think the techniques that you use when we get fillers, Botox, the goal is to not bruise. That is the goal. If you bruise, I think it's a technical issue. In some patients, we're just prone to bruising. So obviously don't be on blood thinners and try to stay away from aspirin when you're going to get this done for at least 72 hours. But I think it's technique driven. In the right hands, there should be minimal to no bruising, no downtime. When we combine it with microneedling, the downtime can be at least 24 hours to 48 hours because you're red, inflamed. It's not like a full chemical peel. If anyone in the audience has had a chemical peel, that lasts for at least a week as the peel process happens. Some deeper lasers take longer. The downtime with these are minimal. In terms of the filling effects with the PRP, you're swollen, but within 12 to 24 hours, it goes away. So I think that's great. Another question that's come through is, when is a good time to consider PRP? Great question. So I think a complete medical history is important with any aesthetic surgery, especially of the face and neck. What I mean by that is, even though we're using your own blood and we say it's safe, it's still a procedure. It's still elective. It still involves injecting, and there's always risk with anything that's injected, whether it's an infection and so forth. So if you're immunocompromised, you have a cold, you have diabetes that's not controlled well, a detailed medical history is critical before you undertake any procedure that's elective. But beyond that, I think the setup for getting PRP is pretty straightforward. Many patients want to come in and just do a consultation to think about it and discuss it, and that's fine. I think that's a very good option because it's not necessarily great for everyone. Someone may have very deep lines, very heavy set, age-related changes to their face that surgery is probably the only option, and it's better to save your time and money, but discuss it with a board-certified facial plastic surgeon, dermatologist. I think board-certified surgeons are the best way to help you in understanding what your candidacy is for the best treatment.